All right, and moving on to this now, altogether 411 babies have been born at state hospitals countrywide in the first 11 hours of 2024. Health Minister Dr Joe Phaahla has announced that Gauteng has had the most births at 112, followed by KwaZulu-Natal with 84 and Eastern Cape with 52 babies. Let's talk more on this now. We're joined via Zoom by Department of Health spokesperson Foster Mohale. Foster, thank you so much for your time. Happy New Year to you too. Certainly, some excitement, I suppose, for the mothers. 411 babies born at state hospitals countrywide.
Good afternoon to you, and Happy New Year, and Happy New Year to your viewers and all the mothers and the new babies were born this year on this special day. Yes, indeed, I can confirm, as the minister has indicated earlier on, that now the number has just increased, just below 500 babies were born by around 2 this afternoon. So probably by the end of the day, the number will increase, might double or triple.
All right. And of course, this is quite significant. And at the same time, one also sends messages of congratulations, I suppose, as a department to the healthcare workers who are also in the front line to ensure that there's safe deliveries.
Definitely, yes. We cannot leave out the hard work, the dedication, the commitment, the selflessness by the hardworking healthcare workers who ensure that these babies they are safely delivered in order to ensure that no baby lose lives during the process of delivery. Yes, they work very hard, as you know, that they put their lives first in order to save the lives and also to bring the lives on this earth.
Foster, there's also been, of course, some concerns around, some of the mothers being teenagers. How much of a concern is this for the department?
Definitely, as the Department of Health, as the various MECs across the country, the minister has indicated, the deputy minister has indicated that we are very concerned with the rising number of teenage mothers who continue to be among the mothers in the country. Of course, it's not only on this special day, Christmas and New Year, but throughout the year, we are very concerned, and we really feel that we need to get all the stakeholders, especially the families, the parents, the sections, the organizations in the community, leaders, the religious and traditional leaders, to join hands with government, especially the Department of Health, the Department of Social Development, Basic Education, in order to assist us in our campaign called Sexual and Reproductive Health Awareness, in order to empower these young people, not only young girls, but together with their counterparts, the boys, in order to educate them about the dangers of unplanned pregnancy. Because the fact that they fell pregnant, people also forget that it confirms that they did not use the protections, especially the condoms, meaning that they are also vulnerable to other sexual transmission, STIs. So this is a serious concern. We need to work hard as parents, as government, join hands together in order to educate, to reduce this scourge of teenage pregnancy.
And I suppose, when one thinks about this as well and what you're raising and talking about these various stakeholders that are now coming to the party to try and address this, are you doing this with police as well? Because there may be possible cases of rape here.
No, definitely we work closely with the police. That's why we had what we call the Tutuzela centers in our health facilities for the victims of rape, in order to be assisted accordingly, to get psychosocial support and also get support in order to open the cases. But the only challenge that we are receiving so far is that most of these teenage mothers, they are not willing to reveal who are the fathers of these babies. We don't know what could be the reason why they're protecting this. But as soon as whoever feels that they want to open to say, look, I'm impregnated against my consent by someone who's way older than me, we'll be able to work closely with the police and social workers to assist these young children to open the case, because this has got serious potential to disrupt the academic journey, because some of them, they may not have that family support structures in order to look after the babies as they continue with the academic journey. And once we take a break from academic journey, I can assure you that not all of them may be able to return. Others may not be able to complete their academic studies, which may add more challenges on the level of unemployment in the country.
Foster, as you say, that some of them don't want to talk, but one wonders then what becomes the strategy to ensure that this particular piece of, the puzzle gets completed and you get to then understand what really happened to some of them. But as you say that you're now putting these measures in place, let's see then if you are going to be able to, really just clamp down on some of what we've seen here happening. Thank you so much for your time. That was the Department of Health spokesperson, Foster Mohale.